How to prevent Alzheimer's disease? That's the million-dollar question, really. Well, what is Alzheimer's disease and how can you best prevent it? Well, Alzheimer's disease is a type of serious dementia that usually is a terminal illness. And although the rate of progression is variable, we know that on average, after 7 years, many people are no longer with us because it is a terminal disease. The early signs of Alzheimer's disease, of course, short-term memory loss, and difficulty attaining new information. Also, the person loses abstract thinking and mental flexibility. They can't really plan abilities or plan their life the way they once did. They're a little more confused about it. So they lose what's called executive planning ability, or executive function, rather. And also there's a decline in fine motor skills, often an early sign where there's a decline in handwriting, which is noticeable to the observer. Or a person able to dress themselves the way they once did, with fine motor skills that are required to do certain tasks. As the disease progresses, you get the more classical signs. Confusion, disorientation, mood changes, irritability, aggression, trouble with language, then long-term memory loss, where the person even has difficulty recognizing old friends or even family members, the heartbreaking part of the disease especially. And gradually bodily functions shut down, and this tends to lead to death shortly thereafter. So how common is Alzheimer's disease? It's the 6th leading cause of death in this part of the world. 1 in 8 people over the age of 65 has Alzheimer's disease. When you break it down, nearly 50% of people over the age of 85 have Alzheimer's, at least 45% of them. And when you look at all the people that have Alzheimer's disease, you see only 4% of cases occur in people under the age of 65. About 6% in people 65 to 74. Then there's a huge jump. From 74 years old to 85, about 45% of people have Alzheimer's. And then after 85 years old, about 45 to 50% of people have Alzheimer's disease, depending on the research that you're looking at. But even after age 65, 10 to 20% of people already have mild cognitive impairment. They're losing the memory chemical. They're not functioning quite as well as they did, even if they don't have classic Alzheimer's disease. Now, there's 3 types of dementia you can develop in your lifetime. There's the classical Alzheimer's disease. Then there's a vascular dementia where you're clogging up your arteries and you can't get nutrients to important parts of the brain. And then there's a mixed form, which is sort of a combination of the two. And the vascular type, by the way, often involves some mini strokes along the way. In Alzheimer's disease, on a macroscopic level, what's happening in the brain? Nerve cells are dying, brain cells are dying, and the connection between brain cells, the synapses where the transmission occurs, is being shut down. So you're getting a shrinking of certain key areas in the brain, like the temporal lobe, the parietal lobe, the frontal lobe, and the cingulate gyrus, if you want to look up those areas and what they do. On a more microscopic level, it's really fascinating that the nerve cell no longer can make optimal amounts of the brain chemical called acetylcholine, so memory loss occurs there. But in Alzheimer's disease, it's even more complicated, that you build up this protein amyloid plaque outside, which sort of strangles the nerve cells. And on the inside, the architecture breaks down and you build up what's called neurofibrillary tangles. That's the hallmark sign of Alzheimer's, those 3 things. But in recent years, we're seeing that high blood sugar levels and diabetes and being overweight are strongly linked to Alzheimer's disease. It's called type 3 diabetes, where you get brain dementia that's significant. Because we're seeing now in the brain, you start to sugarcoat certain parts of the proteins in the brain, and there's evidence now from things that you were seeing in the brain in people with high blood sugar levels, diabetics, people who are overweight, that you get diallyl phosphate building up in the brain, which is a classic sign of sugar-coating proteins or glycosylation of important brain chemicals, and that damages the brain and leads to a type of Alzheimer's as well. So that's a major sort of lifestyle risk factor. So only 1 to 2% of all Alzheimer's disease seems to be linked to strong genetic inheritance. For the rest of us, it's just aging and lifestyle factors that seem to increase our risk. So there's some other common causes of dementia. Parkinson's disease, there's a memory loss problem there. Vitamin B12 deficiency, vascular dementia, as we talked about, head injuries and concussions, But even after the age of 55, we all stop making optimal amounts of the memory chemical called acetylcholine. And so I'm going to talk to you about how you can maintain that level of acetylcholine, because for all of us, that becomes important. There's also nutrients that can stop shrinkage of the brain that occurs as we get older. My problem is that the medical treatment for Alzheimer's disease are drugs that slow down the breakdown of the memory chemical. They don't have any drugs that can increase the synthesis of the chemical. They can only slow down the breakdown. And those drugs in the long run don't work. There's no cure for Alzheimer's disease. They don't have drugs yet that can do it. I can tell you, on the horizon, there isn't anything that promising. The reality is that all the evidence that we have points to lifestyle management, nutrition, lifestyle activities, and supplementation is the key to preserving brain function as the years tick away. Because there are nutrients and supplements and lifestyle activities that can prevent you from clogging up the arteries in the brain. There are foods that can raise your acetylcholine levels and your dopamine levels, which are important for alertness. Things that can decrease inflammation of the brain. There are supplements that are proven to raise the brain level of the memory chemical called acetylcholine. There are no drugs that can actually do this. So at a certain point, you want to start introducing certain supplements that can maintain your memory. Antioxidants are important. Why? Because the brain uses 20% of the body's oxygen at any given time, and oxygen generates free radicals. Studies on Alzheimer's patients show that if you give them high levels of vitamin E, as an example, it slows down the progression of the disease. But for all of us, we need to be protecting our brain over our lifetime with the right antioxidant combination. There are other nutrients that can help to maintain nerve transmission in the brain. Other nutrients are proven to slow down the shrinking of the brain that occurs after the age of 65. Only specific B vitamins have ever been able to do that. There are no drugs that can do it. And there are some experimental evidence that you can stop the buildup of amyloid plaque, which is a hallmark feature of Alzheimer's disease, with using the right supplements and dietary plan. And lifestyle activities, mental and physical activities, are proven to maintain nerve circuits in the brain so the brain continues to function at a more youthful level, and you preserve your mental capacities. You have to put all these strategies together. The best evidence to preserve your brain health is actually to use nutrition, lifestyle, and supplementation practices. My problem is that most medical doctors don't study this in any real detail. And so they wait for Alzheimer's to occur and to get to a certain level where it's advanced, and they start to use their drugs, which don't actually work in the long run in a meaningful way. So what I've done is I've explained all of this for you in a little ebook that's available right here. It's called The Nutritional Guide to the Prevention of Memory Loss and Alzheimer's Disease. I can tell you every single person should download the book and read it through. All the scientific references are there, so you'll understand that it came from good scientific sources. And put those strategies into place in your own life right now so that you can preserve your mental and brain function for the longest period of time. It's such a key part of our quality of life. Alzheimer's is the 6th leading cause of cancer, of death in this part of the world. You can't afford not to be looking at this seriously. Now, at machinohealth.com, you'll see my other research review papers. You'll see other videos I've created, footage from my live professional seminars, other resources and downloads. They're all there to help you lead a long, healthy, functional life. Not just to be alive with a heartbeat, but to be highly functional as the years tick by. All my teaching materials and research review papers have all the scientific references in them, so you'll see it comes from sound, peer-reviewed scientific journals, so you know you're getting only good quality information on any health subject that you're looking for. So you really should make machinohealth.com an ongoing, reliable health and wellness resource for both you and your family members. Thanks so much for watching.